Coming to hemisection of the spinal cord, which is also called as Brown-Sequard syndrome. The lesion involving one lateral half of the spinal cord is called hemisection of the spinal cord. It can occur due to the injury during accidents, gunshot injuries, tumors, etc. Symptoms of hemisection of spinal cord. Here, autonomic functions are usually normal. The other functional changes that takes place can be divided into three categories. Changes that seen below the level of lesion, changes at the level of lesion, changes above the level of lesion. The effects in these places differ on the same side and on the opposite side. There are changes in sensory and motor function. Changes that are seen below the lesion, that is on the same side, there might be sensory changes like fine touch, tactile localization, tactile discrimination, stereognosis, vibration sense, kinesthetic sense, that is sense of movement and position, is lost due to the damage to uncrossed fibers of dorsal column tract. Pain, temperature, crude touch remain unaffected as the spinothalamic tract, that is anterior and lateral, carrying these sensations cross to the opposite side and escape injury. Motor changes. The motor changes resembles the effect of UMN type of lesion due to the damage of the crossed pyramidal tracts. These include spastic paralysis, positive Babinski sign, loss of superficial reflex, and exaggerated deep tendon reflexes. The temporary loss of vasomotor tone due to the damage of the descending fibers from the vasomotor center in the medulla to the lateral horn cells. This leads to dilatation of the blood vessels and fall in blood pressure. Since some fibers of direct pyramidal tracts, that is 15% of opposite side which end in the same side, escape injury, therefore some muscles on the same side of the lesion may not be paralyzed. On the opposite side, there will be sensory changes like complete loss of pain, temperature, crude touch due to the damage to the spinothalamic fibers which come from opposite side, and kinesthetic sensation, fine touch, etc. will persist because the posterior columns of the opposite side are not damaged. Then motor changes like there will be either no paralysis or paralysis of few muscles of upper motor neuron type of lesion. This is due to the possible involvement of direct pyramidal tract, that is 15% of the same side when these fibers cross. Therefore, below the level of lesion on the same side, there is extensive motor loss but little sensory loss, while on the opposite side there is extensive sensory loss but little motor loss, and this phenomenon is called as Brown-Sequard syndrome. This diagram shows the lesion and the involvement of the different tract. On the same side, the dorsal column tracts are affected. The sensation carried by dorsal column tracts, they are lost, and the sensation carried by the ventral and lateral spinothalamic tract, that is pain and temperature, on the opposite side are lost because they are going to cross over here, and there will be lower motor neuron type of injury it can be seen. So that is the motor involvement seen in the same side. The other half, it is motor neurons are unaffected, and this is called as Brown-Sequard syndrome. So here you can see if the lesion is on the left side, so there will be involvement of, there will be loss of touch, of discrimination, vibratory, proprioceptive sensation, and there can be spastic paralysis because of the motor involvement. On the opposite side, there will be loss of pain and temperature sensation and impaired touch sensation. At the site of lesion, there will be total loss of all sensation and hypotonic paralysis. This kind of dissociative anesthesia is called as Brown-Sequard syndrome. Changes at the level of lesion. On the same side, the sensory changes like complete anesthesia occur due to the damage to the posterior nerve root, posterior horn cells, and spinothalamic fibers which cross to the opposite side. Then motor changes, uh, like there will be complete lower motor neuron type of paralysis is seen due to the damage to the anterior horn cells. Complete and permanent vasomotor paralysis occurs due to the damage of the lateral horn cells. On the opposite side, sensory changes like loss of pain, temperature, and crude touch sensation due to the injury of pain fibers of spinothalamic tract which crosses horizontally in the same segment. Then there won't be any motor involvement, nil or very slight due to the damage to some pyramidal tracts